Hello, and welcome to another episode of No Notes, where the conversation is always a perfect 10 out of 10. This podcast is powered by Eleos Health, the most used and most loved AI platform in behavioral health, equipping more than 130 organizations and tens of thousands of providers with powerful automation tools that streamline documentation, simplify compliance, and surface deep care insights that drive better client outcomes. I'm your host, Dr. Denny Morrison, and for today's episode, we are excited to be joined by Correnda Perkins, Chief Program Officer at Hillsides. We'll chat about the undeniable workforce benefits of behavioral health AI, as well as a key cultural and operational considerations behavioral health leaders must account for to ensure AI technology has the desired impact on staff satisfaction and performance. Welcome, Correnda, and thank you so much for being here.
Good morning. Thank you for having me, Denny.
Bet. Hey, so tell us a little bit about Hillsides and what you do there.
Yeah, so Hillsides is a nonprofit in the Southern California area. We're in Los Angeles, and we've been around for over 100 years. We really have kind of three main arms of the agency. And so we have our Family Resource Center, which is all of our community mental health programming. We have our campus-based services, which includes our short-term residential treatment program, as well as a partial hospitalization program and intensive outpatient services. The short term residential treatment program has really been our core program, and that main campus has been the program that's been around for over 100 years. And then we also have our foster family agency. So we have resource families across Los Angeles County, San Bernardino County, and then finally, we have our Youth Moving On program, which is our transition age youth programming, where we have a drop in center and a transitional housing program. I'm the chief program officer, so I oversee all of our programming across all the divisions.
And were you intimately involved with the implementation of AI in your organization?
Yeah, so our senior director of IT had visited a roundtable and he had seen a presentation with Eleos and came back to us running and was like, "Hey, I think I may have solved all of our problems." And of course, we were like, "Yeah, okay." At that time we had extreme burnout across all of our mental health providers. We had about 25 vacant clinical positions out of around 150. That's a lot of vacancies. It's a lot of clients that weren't being served. And those that were with us, they were burnt out. And so he came to us, Tom Foster, and was like, "I think we have some technology that we can use that will really help our staff." And so I was part of the first conversations and we kind of just took it from there.
Very cool. So, what
Yeah.
what were some of the symptoms of burnout that you were seeing among your staff?
Yeah, I mean, we saw obviously the big one was turnover, right? Like staff were just leaving in droves. The staff that were there weren't happy. Paperwork just kind of not being turned in on time, sometimes just not being completed altogether. Obviously, the morale was down. Anytime we discussed any new opportunity or any new change, it was met with a lot of, just frustration and a lot of pushback. Luckily, our clinical staff are fantastic and, they were still showing up every single day for the clients. And so that wasn't something that we were as worried about, but, they just weren't taking care of themselves. And we saw it in all the other ways.
When management comes to staff and say, "Hey, we've got something that we want you to do, you might want to consider." And I suspect Eleos was kind of viewed with a bit of skepticism initially. Is that a fair assessment?
Oh, absolutely. I chuckle because it was faced with all kinds of stuff. It was faced with like AI, like what are they going to take our jobs? It was faced with another piece of technology or something else that we have to learn. It was met with, oh, here comes leadership again, kind of telling us what to do with our day, right? So it was met with all the feels. And it was definitely something that we had to really consider and something that at one point, we were even thinking, is it even worth it to roll out Eleos and start this, just kind of knowing where our staff were.
And so so how did you overcome that? I mean, you got the skepticism, but you think that what you have is gonna help them. I mean, it's kind of a two-edged sword here. What did you guys do to get over that?
Yeah, we took a very slow approach. So, what we did is obviously first we had to get all of our leadership, we had to get all of our executive team on board. And so we had a few presentations. Eleos came, they were great. Anytime we needed them to present to someone, they were absolutely there. And so that was the easy part. And then from there, we started a very small pilot group. And we chose staff who were excelling and doing really well in regards to their paperwork, getting it in on time. And we chose staff who were struggling to get their paperwork in on time. We chose staff who were absolutely technologically savvy and those that ran from technology and literally were just in there to do notes, and that was it. And so we chose just a wide variety of staff because we figured if everyone in that room could get on board, then we could get anyone on board with this. We just said, look, this is some new technology. We really think this will work. We really think that this will make your lives a lot easier. And we've heard from other agencies across the US that are using it and they've spoken highly of it. So let's just try.
How many people did you have in that first group?
We did, I think it was
About
50 people. So we
50.
did
Okay.
around 50
Yeah.
people, and they were clinicians, paraprofessionals, and supervisors. Because
Yeah.
we figured if the supervisors were going to support their teams, they better learn how to use it as well.
Yeah. Good. And what are you up to now?
We are at come actually this month, we will have trained all of our clinical staff. And so that is around 150 to 170 staff.
Wow. And
Yes.
and d do sometimes we still hear about people who are even though generally the organization and the clinicians like it, there's individuals who say, "I really don't wanna do this," for whatever reason. Did you
Mhm.
encounter any of that?
Oh,
The outliers?
absolutely.
So
Um,
what was your philosophy about that? I mean, what or your policy about it?
Yeah. So in the beginning, so during the pilot, and then we kind of did a very slow rollout. We did another year where we just added another 50 staff. And so during that first year, we allowed the staff to say yes or no. So we went to the staff and we said, "Hey, we would love to enroll you in the Eleos training. We would love for you to use it to really kind of support you in your work. Do you want to?" And if they said yes, we did it. If they said no, we talked to them a little bit more. But ultimately, we weren't going to push anyone to do it. And so I think by us not pushing it, I think that also helped with staff jumping on board because they saw that it wasn't like this blanket directive that everyone must use it. It was really, strategic, and we allowed them to choose when they were ready. I think the one thing about this technology compared to others that we had used is it did not impact kind of like the way that they do a session, right? The way that they operate on a day-to-day basis. There was no note dictation where they had to like turn something on and like really like read through everything. There was no computer in front of them and they're typing away doing collaborative documentation, right? Like it was none of that. It was you allowed a bot into your Zoom, or you just hit the power button on a little system in front of you, and that was it. It automatically went into Welligent. And so I think that where this was like this just made it seamless. Like Eleos was just kind of just it was just another like part of our EHR Welligent is what it felt like. And I think that was what was the main difference for our staff.
Yeah, yeah, it does seem like that whenever you start an initiative that says all we have to do is get our clinicians to fill in the blank, you're probably in trouble. 'Cause they don't
Absolutely.
wanna I mean, they really can't deviate from their workflows, frankly. I mean, the productivity expectations, their jobs are kinda like focused, so I think the embedding that Eleos does really does help that and kind of makes it pretty seamless. But that's encouraging to hear that was one of the differentiators. What are you seeing now relative to burnout? I mean, have you got any data or even just kind of impressions about how helpful has this been so far to your staff?
Yeah. So I mean, right now we have a lot of qualitative data, right? Like our staff are just coming up to us and talking to us. Um, when we did our third cohort, so we did our pilot, our first cohort, and then actually our second cohort, they all clapped because they were so excited that they were in the training, right? So it's like that kind of stuff we see the excitement. For those that are using Eleos, they get their notes in within 24 hours, even though our requirement is 48 hours. And they're taking anywhere from 5 to 7 minutes to complete a note. And those that have been using it from the beginning are taking like 3 to 5 minutes to complete a note. And so we can see that in our system. So we're able to track that data. And then also, for those Eleos users that are listening, after you complete a note, every couple of notes, they have a survey. And so in this past quarter, we had 100% satisfaction. And with our group, it is hard to get 100% satisfaction in anything. So the fact that we
Proud
were
to.
able to do that, it was just, I think it was a testament to the system and how it supported the staff. We are coming up soon on our employee satisfaction survey. And so we'll have some specific questions on satisfaction for Eleos users so we can really capture some of that satisfaction data as well.
Do you have any data or even just general impressions about turnover yet? Is it too early to tell that?
So yeah, I would say it's a little too early to see that as well. What we have been told though is so some staff have made the decision to leave our agency, and it's been due to finding a job closer. As we all know, LA County and traffic can be terrible. So if you can find a job within 10 minutes, that's like the unicorn. So some staff have left for that. Some staff have left for management roles, but they've all said in their exit surveys that they almost did not leave because that new agency didn't have Eleos.
Well, and it is kind of encouraging, isn't it, to kind of hear people have to leave with regret about something. In this case, they're not going to have that at my new shop, but I'm not spending half my life in a car either. So, you know,
Exactly.
in terms of, mentioned that the notes are getting done in time well within your standards, it sounds like, and that's a change from what was the case before. I mean, do you have a sense of how many in the past before Elias, what percentage of notes were being done in time versus now?
Oh, Denny, I don't know if I wanna tell our secrets. No, we were at, like, 5 to 7 days
Yeah.
that it was taking staff to turn notes in. So to get it within 24 hours is just, I mean, a significant change.
Yep. And so you're getting the note done faster. W- Have you had a chance to look at the notes in terms of their compliance? Are they better notes? And if so, how are they better?
Yeah, so they are absolutely better. And it's not like our staff are copying and pasting, but I feel like a lot of times you kind of find yourself doing the same interventions. And sometimes, you don't have the time or the energy to be creative and kind of document a different way of doing the same intervention. And so you saw a lot of the same stuff. And now, fast forward using Eleos, the notes are much more robust. They absolutely kind of switch up. They don't look the same from time to time, and I think it's actually truly documenting what the staff are doing, and that's what they tell us, is that they're telling us sometimes they go back and review the note, and they're like, "Oh my goodness, I can't believe I did all of this in the session. Like, I would have never remembered all of this."
Yeah, we hear a lot about that clinicians oftentimes don't think to note that they did an evidence-based treatment, and the AI will say, we use motivational interviewing and CBT for depression during the session, and they go, "Oh yeah, that's right, I did," and it's because they do it just a matter of course. And so, I hear you about the, reminding you, this is what you did in this session. you know,
Yeah,
we
yeah.
we suspect, based on some research that we've done, we suspect that the use of Eleos improves the therapeutic relationship with the client. Have you seen anything that would support that?
We have had staff tell us that they feel like they are more present for their clients, that they're not worried about taking down notes. They're not worried about, oh gosh, when I get in the car, I need to do A, B, and C. I need to get this note done before this session. Like they are just more present and are really there for the clients. We also, about a week ago, we got the results back from our client satisfaction surveys. And there were multiple clients who actually wrote comments saying that my therapist is listening to me, they're there, they're not writing, like someone even said like they're not typing, they're not writing anything down. So we're definitely seeing on both ends the benefit of Eleos.
That's interesting that your client satisfaction would reflect that. I mean, that's a really nice distal indicator of the kind of the fact that the clinician is being more present. They're not, and we all do this. I mean, I just got back from a doctor's appointment, and they're typing and looking at iPads and stuff, and that's kind of healthcare these days. So I
Right.
think that's really interesting that the clients have picked up on that and actually took the time to say it in their satisfaction responses. That's very impressive.
Yeah, definitely. And I mean, yeah, we're in a world now where we're all constantly multitasking, right? We're all doing something. Like we're in a meeting and you see everyone's eyes looking down or to the side because they're replying to an email or responding to a text, right? And so yeah, like using Eleos, our staff really are able to just be there, and it's 100% noticeable to our clients.
Good. Oh, that's
Yeah.
really good to hear. So and you're in terms what now that you've seen these changes, you've got pretty much 100% of staff using Eleos. Has management been tempted to change productivity expectations?
Management, no. We have absolutely not been. Finance is another question. That's another story. Our finance team, yes, has absolutely said, like, "Oh, well, every staff now is meeting productivity." Every staff, we also, in addition to productivity, we have incentives, monetary incentives based on 5, 10, 15, 20% over bill. And, so many of our staff now are meeting 20% incentives. And so they're like, if we do this, then we can see more clients. And I've immediately stopped them and just said, that's not the purpose of this. The purpose was to give time back to our staff. And that's what we told them. And that's what we all discussed prior to rolling Eleos out. And so I want to stick with that. And so far, they smile and they go, "You're right, you're right." So far, that's where we've been, but there's definitely been conversations.
We see that a lot, by the way, that somebody, when after Eleos is implemented, the organization's doing well, productivity is being met, notes is being done. Somebody says, "Hey, maybe we can up the productivity expectations." What advice do you have to organizations that are tempted to do that?
Yeah. I mean, I think it's just remembering why you decided to move forward with Eleos to begin with, right? My assumption is, and some agencies, maybe they are doing it to help increase productivity, to help, increase caseloads. But I think for the most part, people are really looking for the solution because their staff are burnt out. Their staff are struggling to meet paperwork expectations. They're struggling to document accurately, and remain in compliance, and they're struggling to be present for their clients, and so I think that if you remember all of that, it should be an easy battle with whoever's trying to push for something else. It should be an easy battle to kinda put your foot down and say no. Our clinical staff can only do so much, and what we're seeing, at least in LA County, is, increase in severity of symptoms, kind of those programs that were traditionally less intense, your kind of traditional outpatient school base, are now just as intense as our intensive services. Our staff are not only managing what's going on with our clients, but with everything going on, it's what's going on with their families as well. And so, they are just burnt out from all areas. And I think that those should all be the reasons, and the strategies you use to push back on increasing productivity.
Well, speaking of finance, I mean, just have you when you were doing your determination and due diligence, how did you guys have a a model for how you're gonna determine ROI? A buck spent on Eleos is worth it because why? I mean, how did you go through that calculus?
Yeah, so, I think at first we didn't really know what to expect. And then as we started to really get in it and do the pilot, I think at that point we realized that we would really start to base the ROI on how long it took for them to submit a note and then how long it's taking them to submit notes. And then always, obviously, client satisfaction or staff satisfaction. That plays a huge role in it as well. So immediately, using Eleos's dashboards and all of the data they sent us, we were almost immediately able to see a return of investment. Immediately before they even became superstars, staff were already seeing a decrease in how long it took them to write notes. And obviously, we talk a lot about our clinicians, but all of our paraprofessionals are using Eleos as well. So our peer and parent partners, our behavior specialists, our facilitators, and they're all using Eleos as well. And we hear such great feedback from them. And they've even said to us, like, it would take us sometimes 30-40 minutes to write a note. They're able to now get their notes in like 7 minutes. And so I think that also it's been such a huge point and played into the ROI
Yeah, I
determining
think,
that.
as you and those are all kind of like relatively short-term benefits. I think in the long term, once you have enough time to track turnover and those kind of things that, because that does take a while, before you probably have a significant impact in that. And even in the short term though, like you mentioned, you still have some turnover, but just qualitatively, you might see differences in why people are leaving. When they do their exit interviews, it's, we're not hearing that I'm overloaded, I'm burned out, I'm tired, I don't want to do this anymore kind of stuff. It's I got a better job, for whatever reason.
Right. Yeah, exactly. I got more money, I got a better job, it's closer to home. I
Yep.
also think that we've been using it not only for turnover, but as Eleos is growing in LA County and more people are hearing about it, we use it as a recruitment tactic as well. And so it's something that our HR team uses in our job postings. We're working with Eleos to kind of create some strategies to put in like maybe a video. So we're definitely looking at it also to not only address people leaving, but to help us recruit quicker. Because people, like you said, Denny, like people are going to, no one's gonna stay in the same job for 40, 50 years, right? That's just, my parents did, but, like, that's not something that happens anymore, and so our goal for us is to also not have a seat vacant for too long, and that's how we also are using Eleos.
Are you seeing there any results from that kind of change in terms of how you advertise jobs? I mean, are people mentioning that when they come in for a job interview yet, or have you implemented it yet?
So we have some communication out like on our job descriptions and stuff. It says it, but we have had a small few that have said, "Oh, I've heard of Eleos. I was super excited to hear that you all are using it as well." So I don't know if that was the determining factor to them accepting the job, or if it was just an added bonus. But that's definitely something that we're gonna be tracking, and our HR team is on it because
Yeah,
they're.
well, again, the fact that they would mention it at all, it's like at least it's getting some awareness out there, which is good for you guys. I mean, in terms of, I mean, this is a tough environment to be hiring in, I mean, in
Yes.
general,
Yeah.
So
And we were one of the first in LA County, so don't you worry, we brag about that. And we're like, "Oh, well, we're the first, so, we get dibs on everything, right?" Like,
yeah,
we
yeah,
do whatever we can. Um,
yeah,
but yeah, so that definitely, I think it's helped
yeah.
for
Hey,
those that
did
know
you
about
see
it.
when you implemented? I mean, did you see much difference? Because you in your pilot group, you had a pretty broad continuum of tech savvy versus not.
Mhm.
Did you see much difference in terms of adoption or kind of uh, just any differences between people who really were versus were not tech savvy and how it was viewed?
Yeah, I think, the staff that were a little less tech savvy, and also those that just kind of struggled with change, they didn't even like they were like, "Yes, I'll do it," but, like, they didn't use it. Or what they would use is they would use other features of Eleos to support their notes, but, like, wouldn't dive fully in, right? And so, like, maybe they would write the couple of bullets that would, like, translate into a note. So what we did do, halfway through year 1 is we did a luncheon with our super users and our users that barely used it, that had, like, 1 to 2 notes a week, that was it. And during that lunch, we were completely transparent on why we were doing it, and they all knew who they were and that, what category they fell into. And we allowed them the time to just talk. I mean, it becomes a little informal when you have food and you're just hanging out. And the super users are like, why aren't you using this? Like, this is great. There was one staff in particular that was like, this system had, like, Elios has just saved my life. Like, I have so much more free time. Why aren't you using this? And the staff was like, well, I just like couldn't really figure it out. And then the super user was like, pull out your computer. And literally in the moment, the super user helped the user. It feels weird calling them super users and non-users, right? But the super user supported the other staff. And since then, the staff was like, I think I saw her a couple months later and she was like, Correnda, I can't believe it took me this long to adopt it. Like, it is like what they're saying is true. It's a game changer. For those staff that are a little less tech savvy, that was our strategy and it worked. And, I think that a lot of times, they hear us talk and they're like, yeah, yeah, okay, leadership. Yeah, yeah. Like, you just say whatever. But to hear it from your peer and to hear how beneficial it is from your peer, I think help them get over their fear of technology. And then once they saw it was easy, right? Like, you don't have extra clicks, you don't need to log into 2 systems, you don't have a separate password to remember. Like, it's literally embedded into our EHR. There's nothing you need to do except for to get your client to sign a consent form, right? And then
None of
review.
this. You don't have to do one of those, and you know,
Yeah.
do you see a lot of non-English speakers in your client base?
Yes.
How does
So
that how has that worked for you with Elios?
yeah, so I would say probably around like 70% of the sessions that we provide are with monolingual Spanish speaking clients. So translation services for us, it was a huge deal for us. And it was actually something that Eleos that we brought up to Eleos in the beginning. So during the pilot, staff were like, this system is great, but like my notes are in Spanish, so I can only do or my conversations are in Spanish, so I can only do this with so many clients. Or if I'm starting a session with, like, a kiddo and the parent comes in and all of a sudden now we're all speaking Spanish, like, it's hard. And so, we did talk to Eleos, and, they were like, "We hear you, and that is absolutely something that we will put on our roadmap." And I'm used to hearing from EHRs and technology-based companies, like, their roadmaps are, like, 24 or 36 months, right? And they were like, "No, like, we will get this done as fast as we can." And they did. In less than a year, we were part of the pilot to do Spanish, sessions, and our staff loved it, and now obviously there's, Eleos can translate into many different languages. We predominantly use Spanish, but yeah, it's been, something that staff have really liked, and I think something that we've always appreciated about Eleos has been anything that we've brought up, like, "Hey, this could make it a lot better and easier for our staff," they've been willing to hear us out. And for the most part, they have either said, "We're already working on it, we're a couple of steps ahead of you," or they've said, "That is excellent, we'll bring it back and we'll see what we can do." And almost everything they've delivered.
We're running up on time here, so what would you want people to know if they said, "We're gonna get ready to look at AI, maybe look at Elios generally, but more specifically, but look more generally, we're looking at AI." What advice would you have, kinda given your history and your experience with this?
Yeah, I would say first and foremost, uh, I would say it works, so don't be afraid to use it. everyone has this idea of Hollywood AI and technology, and it's going to take over the world. And I think, get past that, because it absolutely can make all of our roles easier, and it's not there to replace us. And at least in the mental health field, you can't replace a human body. So I think that would be my first. And then I would say just do your research, right? Like find the system that works best for you. Find a system that works great with the technology you already have in your agency, because like we've talked about, to have disjointed technology just doesn't make it easier for anyone. So don't do it. And then lastly, I would say kind of be thoughtful in how you roll it out with your staff. If you have the flexibility to do so, do it slow, strategically. I think no one likes to be told what to do and how to do it and when to do it. So wherever you can, try to stay away from blanket policies and statements, and just let staff adopt it when they're ready.
Well, I think that's a great place to wrap it up here. I want to thank you so much, Correnda, for all this insight that you've given us, and congratulations on your experience with this technology. And I'm glad to hear, as a former clinician, I'm glad to hear your clinicians their lives are a little bit better because of this. So thank you so much for doing this.
Yeah, thanks for having us. Hopefully this helps, an agency who's trying to figure out if it's something they want to use.